Upon entering the field of paramedic technology, I was unaware of how profound of an impact communication would have on the treatment of my patients. It is only now, after gaining some experience in the field, that I realize the need for a true understanding of communication and its effects in the pre-hospital setting. There are many steps in the communication process in which information can be lost or misinterpreted, as well as other language barriers such as age, gender, culture, crisis, and the communication skills we possess that may present additional problems along the communication pathway and in the treatment of your patients. I have chosen two areas to speak to you about today that I have found to be the basis of most of the communication problems in the pre-hospital setting. The first being the ability to listen and act empathetically, and second is the use of nonverbal language in patient interactions. Mosby's Paramedic Textbook 2012 states that therapeutic communications can have several important effects. It can provide the paramedic's interaction with the patient, ensure better patient care, diffuse potentially violent situations or prevent them from escalating, and reduce the risks of lawsuits. There are several factors in communication that assist in breaking down the barriers between caregiver and patient. However, I will focus on the two that I have found to be of most importance in this field. First and foremost is empathy. The ability to be able to take yourself out of the equation and see the situation from your patient's point of view will make a dramatic difference on the effect of your patient's experience on the call. A call that sticks out for me where empathy was so very important involved a woman in her late 30s with stage 4 breast cancer. She had recently begun having seizures, which as a medical professional, knowing her diagnosis, I knew was not a good sign. She was terrified she was going to die. After a quick assessment, we moved her to the ambulance and began our 45-minute transport. During this time, my patient was sobbing and afraid, so I took her hand and kindly asked about her family. And from there she began to smile, and at times even laughed through her tears. When I left that patient, she was no longer sobbing, but smiling, and thanking me for helping her through this difficult time. In some cases, my face may be the last face my patient sees, and my voice may be the last voice that they hear. So my ability to be empathetic to their situation may make all the difference in that moment. I have seen people in this career lacking this one skill, and their patients were often rude or disconnected, and frequently left out information that may have been critical to their treatment. Second is kinesics, or body language. This can make light of or escalate your caregiver-patient experience very quickly. In this field, we encounter all kinds of people, the young, the old, patients with psychiatric illnesses, patients using street drugs, and so on. With this comes a great many temperaments and moods. Some are quite happy to see us and some fear us. Take, for instance, a patient around the age of 3 with an injury to their arm from a fall. If I were to arrive on the scene and immediately approach the child who is already hurt, crying, and afraid, and tower over them to assess them, I am most likely going to escalate the child's fear and anxiety about the situation, making my ability to assess that child's injury more difficult. However, if I instead enter the scene, assessing what I can from a distance, and slowly approach getting down to the child's eye level while speaking calmly about who I am and what I need to do, and involve the child as much as possible in the assessment, I am most likely to reduce the fear and anxiety the child has. You see, a child of this age is already hurt and afraid, so when you add in a stranger in uniform, the situation becomes a little scary. According to Mosby's Paramedic Textbook 2012, the paramedic should gradually make contact with the child during the parent interview by moving to eye level with the child and using a quiet, calm voice. It should be remembered that children are especially responsive to nonverbal cues. Body language plays a role in every patient encounter, whether it's making them feel insecure like the child in the above scenario, or if it's a frequent flyer that ran out of their pain meds too soon, and you simply ignore them throughout your transport while typing your report. We have discussed two important areas of communication in the pre-hospital setting, including the necessity for EMS personnel to interact empathetically with their patients, and how the use of poor body language can affect communications with your patient and ultimately your patient outcome. In conclusion, the use of proper skills in communication is crucial in every patient encounter in the pre-hospital setting and can sometimes be a matter of life or death.